My background and training is in public health and in geography. I have a doctoral degree in geography, and the area is medical geography, which is essentially the study of health and disease in places and all the contributors in place that affect health and healthcare. And that's really brought me to my focus on communities. Much of my work, essentially all of my work, is done in a community-based participatory approach that engages communities actively in involving from the beginning of planning the research project, identifying the needs of the project, and carrying it out and analyzing the data. My current work is really three-pronged. One is working at the policy level to help sustain community health workers and bring about the ability for them to be reimbursed for their services through our healthcare system. A second area of research looks at how community health workers can be integrated directly into healthcare, interdisciplinary healthcare teams in federally qualified health center settings. And another area, and I'm deeply involved with IHPI partners in this, is the evaluation of Michigan's Medicaid expansion, the Healthy Michigan program. I'm leading a part of the Healthy Michigan evaluation that's focused on communities. We're doing community case studies, really listening to the voices, asking people in the communities who are directly affected, how is it unfolding? What are you seeing happen? What do you expect the impact of this to be? And what's it like from the perspective of the new beneficiaries of insurance? How are they experiencing this change, and what do they think the impact is going to be? And we're doing this in 5 geographic areas around Michigan. I think we could be a model for other states that are also doing surveys and could potentially learn how to actually ask the people involved to talk about it in their own voice. A lot of health services research tends to leave social workers out. I was delighted that IHPI invited me to participate because I think it was a recognition that the social determinants of health are a huge part of health and healthcare, and that social workers play a major role in helping to address those social determinants of health and help to make sure that people have what they need in order to build a healthy life. I think a huge issue is health inequities. So the inequitable distribution of health and healthcare in populations. And a flip side of that, or a related issue, is too much health care. So the wrong kinds of health care given too often to too many people. These are both interconnected, and we need to solve both. IHPI is a center of innovation. It's a collaboration of wonderful scholars who are doing research together, really with the point of view of affecting policy change, addressing inequities, improving access and quality of care, I think in a very innovative and progressive way. IHPI has made a huge difference in my ability to do my work, especially at the stage it was in. I was working in intervention research. I was doing that work, but I was frustrated at the inability to translate that into policy change. So IHPI formed at a point that's very, very important for my vision of seeing this research turn into actual practice and policy innovation. My vision and hope is that many of the reforms that are happening now, we will be learning from some of the limitations that were placed on our healthcare reforms and be able to move forward and say we're going to do more. I think IHPI can contribute to this, first of all, by reminding people that health services research is broad, that it includes communities, and that also its work, its innovations in studying and implementing policy change in healthcare will be well integrated. I'm firmly believing that if we do that, we will actually make a huge difference in the healthcare populations.